Ever wonder what roles nurses play in long-term care settings? I'm here to tell you all about it. Hi guys, welcome back. My name is Muriel. This is my channel As Told by Muriel. I am a registered nurse of a little over a year. Prior to, I was a licensed practical nurse of 18 years. On today's video, we're going to discuss the different roles that nurses play in long-term care settings, also known as acute rehabilitation settings, also commonly known as nursing homes. Okay, first I'm going to speak on administration. Now, this one is kind of set apart from the rest because an administrator doesn't necessarily have to be a nurse, but an administrator can be a nurse. Administrators are like the top dogs in the building. They basically are over everything in the building when it comes to funding, making sure that the budget is correct, making sure, they're basically over budgeting, but they're the head person of the building. They're over everyone in the building. Like everyone works under the administrator. Administrator is normally in direct contact with all the department heads in the building of all departments, dietary, nursing. They normally are, and got direct contact with them. They don't do direct patient care. Administrators are normally salary pay positions. On to director of nurses. Director of nurses are always nurses. I know in the past there have been director of nurses who are licensed practical nurses, but director of nurses are commonly bachelor's prepared as well as associate degree nurses. There are several facilities that hire associate degree nurses to be director of nurses. It's normally a salary pay position. Directors of nursing are over the nurses and nurses assistants. That's who they are over. They do their meetings with different nurse supervisor, unit managers. They do meetings with the nursing assistants. This is who anyone in nursing staff takes their complaints to. If they have any complaints, if they have to get their yearly evaluations. This is who they have to see for any type of disciplinary action that's above that of the unit manager or a supervisor. But basically that is what the DON does. This nurse isn't specifically hired for direct patient care, but they have been known on occasion to have to what we call work the cart in long-term care settings, which is be the nurse who provides the medication for the floor. And in circumstances where it's extremely short, this position is normally a Monday through Friday salary pay position. In some facilities, they also have an ADON, which is an assistant director of nursing. Not all facilities have this. Some do, though. This is a nurse who is normally a registered nurse, but can also be a licensed practical nurse. This nurse reports directly to the director of nursing. What their title says, they assist the director of nursing. So the things that director of nursing can't get to, say, such as doing in-services, going floor to floor, making sure the floors are being, maintained. That's what this nurse does. She assists the director of nursing. This nurse is normally an hourly paid position. And like I said, it can be held by an LPN or an RN. Next, we will talk about supervisors. Supervisors mainly work on the weekends. Because on the weekends, they're the floor nurses, the CNAs, and all the other staff, but there really isn't anyone in there to oversee the entire nursing side of the building, like the nurses. So most places hire a weekend supervisor. This person is responsible for coming in. They make sure that staffing showed up. If staffing hasn't showed up, they make the calls to try to get staff in the building. They make sure that documentation is being done by the nurses and the CNA. They normally sit in an office, and they can come out on the floors. They handle patient and family complaints. Most family members, once they go to the direct floor nurse, they'll come to the supervisor for any family complaints. They make sure that the paperwork is being done that needs to be done on the weekends. Occasionally, the supervisor will have to work the cart if they're short and the nurse doesn't show up, or there's a hole in the schedule where a nurse isn't there to work. The supervisor will take the cart and work. This position is normally held by an RN, can be held by an LPN, and this is an hourly paid position as well. Like I said, supervisors are normally utilized on the weekends because normally there's always the DON or an ADON in the building during the week. Okay, now we'll talk about treatment nurses. Okay, treatment nurses are nurses who can be an LPN or an RN. They're specifically hired to do wound care treatments on the patient. So treatments can vary anything from a razor cut from a patient receives onto a stage 4 pressure wound that a resident has who needs more intensive wound care done. Treatment nurses normally work Monday through Friday, but there are occasions where treatment nurses will do 3 12-hour shifts. They'll do the treatments in the building while they're there, but they leave direct instructions on how to care for certain wounds so that the nurse who was working that day, if they don't have a treatment nurse, they can do the wound care for that patient for that day. Treatment nurses, I feel, need to get specialized certification. I don't know if they do, not certification, but there are classes they can take in order to know the different types of materials that need to be used for certain wounds, because every wound doesn't require the same care. Some require higher levels of care than others. Like you wouldn't treat a skin tear like you would treat a stage 4 pressure wound, and an average nurse is not going to know what you need to treat different types of wounds just from not, that's not what we learn in school. So they only have to take certain classes in order to know how to treat certain wounds. So this is a treatment nurse position. This position, they do have direct patient care because they are treating wounds on the patient. This is normally an hourly paid position in a lot of facilities. I've never worked in a facility that didn't have a treatment nurse. They may be short at a time and not have one for the position, but they always try to hire one. Like I said, when there isn't a treatment nurse in the building, the nurses who are working the floor, they have to do the treatments. Okay, now let's go to unit managers. Unit managers are managers who are assigned to a specific floor. So let's say there are 4 floors. You may have 4 unit managers. Sometimes when you don't have 4 unit managers, you may have 1 unit manager who works 2 floors. This is the person who is making sure that the nurses and the CNAs are doing their documentation. The work that needs to be done is being carried out. Like if a patient is supposed to have a shower, the unit manager will make sure that that list is prepared for who gets what showers on what days. That unit manager basically makes sure that the floor is being run efficiently that day, that the work is getting done, because documentation is there's a real problem with documentation in long-term care facilities. People neglect doing their documentation, and documentation is very important in a long-term care facility. Occasionally unit managers end up having to work the floor because if they are short a nurse, they will pull the unit manager to work the floor. Unit managers typically make, I say $1 to maybe $3 more an hour than the floor nurse. Unit managers normally work Monday through Friday, but they are known to have to take calls sometimes on the weekends, which I don't like, because if I work Monday through Friday and then I get called in Saturday and Sunday, I've worked 7 days straight. This doesn't typically happen, that they have to work the whole weekend, even though they work Monday through Friday, but sometimes it does. Unit managers, they work on holidays. They work, like I said, Monday through Friday. Typically, they will be off Saturday and Sunday, but on occasions, they be on call. They have to come in. This position can be held by a licensed practical nurse or a registered nurse. Okay, and now and I spoke on documentation, and it's specifically for this nurse. This is the MDS coordinator. This is the nurse who is in charge of all the Medicare funding for the building, as far as making sure that the building is getting properly paid for the level of care that they are providing for the patients. Different patients require different levels of care. There are some patients who need extensive assist, some patients who need total care, and some patients who only need minimal assist. The MDS worker is in charge of doing the assessments weekly, monthly, quarterly, and yearly to make sure that the building is getting the Medicare funds that is owed to them from the government in order to pay for the care for these patients. This MDS worker has to take, sometimes they are trained on the job, but there is training, specific certification that is done for MDS workers. Training can be done totally online, or it can be done in like a seminar that is given. I think it's a monthly seminar that they have in different locations in the United States. But an MDS worker is very important to the building. The MDS worker makes sure that the building is getting funded for the care that is given to the patient. The MDS worker normally works in the office. They're normally there Monday through Friday, 8 to 5, 7 to 3. But what I like about MDS workers, they can basically set their own hours. If they decide today they want to come in 3 to 11, they can do that, because the paperwork that they're doing, they can do from 3 to 11. That's what I like about MDS. That's a certification I'm going to be looking to get in the future myself. MDS workers are in all different types of facilities, because all different types of healthcare facilities are getting paid through the government and receiving Medicare and Medicaid dollars. So there's a diaspora of places you could work as an MDS worker. And they very rarely do you see an MDS worker working on the floor. They sometimes can get pulled in desperate measures when there is not a nurse to cover a spot in the building. But 9 times out of 10, you will not see an MDS worker working on the floor in most facilities, because their job is extremely important. The larger the facility, the more work an MDS worker has to do. Sometimes you'll even see 2 MDS workers in the building. Say you have a facility that has like 130 patients. Well, that's 130 or more assessments that this MDS worker has to do just on a yearly basis, not to mention the monthly, the quarterly, assessment that they have to do. And they work totally off of the documentation that is done by the staff. So if staff is not documenting, MDS workers cannot do their job. So that's why documentation is extremely important. I know sometimes we as nurses and even CNAs, they get tired of you constantly, document, nobody document, but that is needed to fund the building, and that funding is primarily what pays our wages. So as an MDS worker, infection control nurses are nurses who are in the building specifically for infection control. They track infections in the building. They track the spread of infections in the building. They give in-services on hand wash. Their in-services is information given according to CDC guidelines. Infection control nurses are very important, especially during this time of, what's going on, this pandemic. So they don't set the guidelines, but they follow the guidelines set by the CDC in order to prevent spread of infection in the building. They normally, usually the nurses, infection control nurses, there's a class that they have to take. Definitely have to, not normally, but I'm pretty sure there's a class that they have to take in order to become infection control nurses, because you don't just know some things you just don't know just from being a nurse, because we don't learn those things in school. So that's why an infection control nurse taking those classes are very important. They also are the nurses at time who administers the hepatitis B vaccines to the staff, the influenza vaccines to the staff. Even if you decline these things, they are the nurses that keep that paperwork together and put it in a file saying that you declined these things or you had these things administered. They normally are the nurses who keep up with this, as well as say a patient who gets reoccurring UTIs. That needs to be tracked. What is causing these UTIs? Is it sanitary practices not being followed by the staff, or is it this patient's medical history and this is something that commonly happens with them? What's going on? Why is this patient not always getting UTIs? So that's infection control nurse is a very important nurse to have in a facility. Like I said, I've worked with infection control nurses in the facilities I've worked. There has always been an infection control nurse. This nurse normally works Monday through Friday, off on the weekends. This is normally an hourly pay position as well. They really don't do direct patient care. They're more there for their care as far as care wise is normally given to the staff, but they track infections in the building for the patients. So that's an infection control nurse. Let me see that. Oh, and now we're on to the floor nurse. In my opinion, the floor nurse, I don't want to say is the most important nurse, because that's the position I normally play in a facility. But I will say, other than nursing assistants, the floor nurse is the nurse who has the most direct hand-to-hand patient experience. This nurse is a nurse who they know their patients. They know the patients on the floor that they work, even the floor they don't work. They sometimes will get pulled to that floor. This nurse is the nurse who provides the medication to the patient. On times they have to do wound care to the patient. They get to know the patient. They know if the patient is behaving a certain way. This is what Miss Jones normally does. She does this on rainy days. You know, they get to know their patients well. If a patient is acting or behaving a certain way, they know, oh, well, this patient did this before when they had a UTI. Let me call the doctor, get these vital signs. Let me call the doctor and let them know the patient is behaving in such a way that they did when blah, blah, blah. This nurse is also the nurse who makes the assignment, the daily assignments for the CNAs. They assign the groups. They make sure that the CNAs are doing their documentation, that the showers are being done that need to be done, that the patients are being fed. Say there's a patient who a CNA comes and say, well, Mrs. So-and-so was choking when I was feeding them. That nurse may go in and attempt to feed that patient. They see that patient is choking or this patient is coughing a lot. The nurse takes it, you know, she could take it upon herself to downgrade the diet so that the next meal that patient isn't on such a heavy consistency. And then, you know, she'll call the doctor and so-and-so was choking when we did blah, blah, blah. I had to downgrade that diet. The doctor may order that the patient have a chest x-ray, make sure they didn't aspirate. This nurse is a nurse who the families are more familiar with, because when families come in and have anything they want to say or any questions about care for their family, they normally go to that floor nurse and speak to that floor nurse over any of their concerns. The floor nurse is also the nurse who has a lot of interaction with the doctors of the facility, because the doctors of the facility, when they give orders or have questions, they're going to want to speak to that floor nurse, because that floor nurse is who knows more about their patient. The floor nurse, you know, the floor nurse holds a very important role in my eyes. These nurses normally work for facilities and do 8-hour shifts. They can work weekends. They work weekdays. Sometimes they're 3 12-hour shifts. Sometimes they're 5 8-hour shifts. I call the floor nurses and the CNAs the bread and butter of the facility, because they have the most direct hands-on patient care than any other members of staff in any department. Like I said, I've been mainly in long-term care my whole career. I have a lot of experience on being a floor nurse, and the floor nurse is a nurse who'll know, you know, sometimes a patient medication is changed in the middle of the day, and that floor nurse is going to know the doctor discontinued this medication yesterday. Let me go in the computer and, you know, maybe someone didn't discontinue it in the computer. Let me go in the computer and discontinue it because the doctor changes medication. The MDS nurse is not going to know that. The infection control nurse is not going to know that, you know, but that floor nurse, she works with that patient. She know that that doctor discontinued that order, so she know not to give that patient that medication. So floor nurses are very important in a facility. These nurses are hourly paid nurses. So these are the different roles that nurses can play in long-term care settings. For those women who are like me, who prefer long-term care setting or any setting outside of the hospital, because I just know that is not for me. So just wanted to inform you of these different positions. See, you know, if there's one that you may be interested in doing. Like I said, MDS and infection control nurses, there are classes they can take outside of their licensing that could qualify them for those positions, and those 2 positions on their own, they're not bedside positions. So, you know, there are some nurses who are just adamantly against working at the bedside. And those are 2 positions that infection control nurse, I've never seen an infection control nurse work on the floor, on the car. And MDS, very, very, very rarely have I ever seen an MDS nurse work on a car. It very rarely happens. I know that it does happen, but it is not preferred in most facilities for the MDS nurse to work on the cart. Thank you for watching my video. If you have any questions, leave them below. Like, comment, and subscribe to my channel, as told by Muriel. And I am Muriel, and I will see you on the next video.